Living with peripheral nerve pain can devastate and destroy the quality of your life. It can prevent you from doing your favorite hobbies, engaging in the things you love most. It can even prevent you from spending time with your family because the pain is just too unbearable to even think about socializing with anyone. So in attempts to control your pain, you're forced to take strong medication. The problem is all the medications used to treat the pain do nothing to repair the nerves. So if all you're doing is taking Lyrica, Gabapentin, or Cymbalta, your chances of reversing neuropathy is nil, zero, a big fat goose egg. But don't worry, I'm going to tell you what you need to know about these medications and how you can control your nerve pain without them. Don't go anywhere, it's going to be good. Hello Health Explorer, this is Dr. Coppola, the Nerve Doctor. If you've been told your neuropathy is permanent, I'm here to help you achieve new levels of health you never dreamed possible. Dr. Montero and I make it our mission to stay up to date with the most current research, and so we can arm you with the information that will help you recover from neuropathy. So make sure you click the subscribe button for up-to-date and accurate information on peripheral neuropathy and what you can do to overcome it. Also, don't forget to click on the bell so that you get notified when I publish new content. So let's get started. When you're suffering with peripheral neuropathy, it's extremely important to be able to control your pain and symptoms. Otherwise, it can end up destroying your life. However, the problem I commonly see is that with most peripheral neuropathy sufferers is that the only thing they're doing is managing their symptoms with medications like Gabapentin, Lyrica, Cymbalta, or even opioids like tramadol. Did you notice I said managing their pain? Here are 6 things you need to understand about these medications. They don't help or heal the damaged nerves. They only mask the pain temporarily at best. Your body will develop a tolerance to them, causing you to need higher and higher doses. They have significant side effects. These can include feeling like a zombie, that's how my patients describe it, weight gain, mental confusion, and even memory lapse. In fact, I had a patient who told me she took her evening dosage of Lyrica and then went to bed. Well, check this out. She woke up at 7 a.m. in her pajamas, behind the wheel of her car, in the parking lot of Walmart, with absolutely no recollection of leaving her house or even driving the vehicle. Unfortunately, this is not an isolated incident with this drug. Also, many people experience depression or suicidal tendencies while on these medications. Other issues while on these medications can result in increased nerve damage while taking them. Also, Lyrica, Cymbalta, and tramadol have been shown to cause dependency while on them and can have significant withdrawal symptoms when stopping their use. This is a regular conversation I have with my peripheral neuropathy patients. Now, don't get me wrong, if you're currently taking these medications and they're giving you relief, don't stop. And never stop taking any medication without consulting your doctor first. Doing so can cause serious harm. But here's what I'm saying. If plan A is managing your pain with medications, you must have a plan B. Plan A is the short-term goal involving managing your pain the best way possible so you can live your life and remain as comfortable as possible. By the way, many of my neuropathy patients don't have pain. They only have numbness, muscle weakness, or maybe a loss of balance. But they've still been placed on one of these meds. If your neuropathy is not painful in any way, you absolutely should not be on any of these medications. If you don't have any pain associated with your neuropathy, I highly suggest you set up an appointment with your doctor to discuss weaning off the medications. On the other hand, Plan B is the long-term goal that involves healing the damaged nerves and allowing the pain to dissipate while restoring nerve function and your life for that matter. When this happens, then guess what? These drugs are unnecessary. By the way, Even if you don't have pain, let's say you only have numbness, weakness, or loss of balance, you still need a plan B to repair those nerves, which will restore the feeling in your feet, your balance, and your strength. Okay, for those of you who are not on any of these medications, or maybe you're on low doses and want to know how to control your pain to get off these meds, I'll cover some temporary treatments that have been effective for pain control. Remember, these treatments that I'm about to mention will not repair the peripheral nerve damage. They will only help with pain management. If you want to know how to reverse the damage to your peripheral nerves, I'll leave links in this description below to a few of my videos that will tell you how to accomplish that. For now, let's talk about alternatives to controlling your pain. I'm going to review 8 proven treatments that are safe and all natural with no side effects and have been proven effective in clinical studies. The first one is acupuncture, which started in China and has been used for 3,000 years. The National Institute of Health studies has shown that acupuncture is an effective treatment either alone or with conventional therapies for treatments like chemotherapy-induced nausea, fibromyalgia, low back pain, nerve pain, shingles-related nerve pain, headaches, and much, much more. In order to become certified and a licensed acupuncturist, you need to have at least a master's degree. Certain states require a doctoral degree, so there's no doubt these healthcare practitioners are highly trained and qualified. Now, the second one is massage therapy. Therapeutic massage has been found to be effective at temporarily relieving pain by helping to close the pain gate. And it does this by stimulating competent nerve fibers and impeding pain messages to and from the brain. Now, the way that massage therapy actually works is that it stimulates specific pressure receptors in the muscles and joints, which are specialized nerve fibers, which then cause the brain to release endorphins. And endorphins are the body's feel-good hormones, which can quiet down nerve pain. The third technique for controlling pain is something called tapping, also known as emotional freedom technique or EFT. Now, this is an alternative treatment to address physical and emotional pain. This 5-step technique utilizes acupressure meridian points to reduce pain. Now, research has shown that EFT is effective at treating chronic pain such as fibromyalgia, anxiety, depression, addictions, even symptoms of trauma, and a host of other emotional and physical problems. I've included a link in the description box below to a research study on this technique. And I've also included an excellent YouTube video so that you can learn how to do this simple and effective technique to get your pain under control. All right, let's move on to technique number 4, which is meditation. Now, recent research has shown that even just 3 20-minute meditation sessions can help decrease the perception of pain. Other research from Brown University found that meditation changes the way the brain functions. Now, many studies have been conducted by the Mayo Clinic, Harvard Medical School, University of California, Berkeley, and many others, which have all drawn to the same conclusion, that mindful meditation can lower chronic pain levels in the body. There's a ton of information on the internet about this, so I won't go into any detail. Now, the challenges that people encounter when trying to meditate are the following. The first one is, believe it or not, doubt, or you simply don't believe that it's going to work. Now, push this doubt aside and just tell yourself, I have nothing to lose and everything to gain. Another challenge is restlessness, or just difficulty physically sitting still for a long period of time. If this happens to you, focus on your breath or the voice if you're doing guided meditation. Now, equally as challenging is just maintaining your focus or keeping your mind from wandering. Again, if this happens, redirect your focus on your breath and the guided meditation. Now, here's another challenge, and that is sleepiness. I've had this challenge myself, and I found meditating first thing in the morning after a good night's sleep works well for me. And also, just simply sitting upright can also help. I've often found the best way for my patients to get comfortable and become proficient with doing meditation is by beginning with guided meditation, where you have an instructor who's walking you through the meditation, the breathing, and even the imagery. Now, there are many YouTube channels where you'll find guided meditations. One in particular that Dr. Montero and I personally use and share with our patients is by the Honest Guys. They produce almost every type of guided meditation imaginable, and they do a great job at it. I'll include a link to their particular channel as well below. All right, moving on to number 5. The 5th treatment for chronic pain is CBD oil. Now, CBD oils have been increasing in the medical field for treatments of various conditions. There's been a number of favorable research studies that show it can be effective for chronic pain. I've included a link in the description below to some very interesting studies. However, not all CBD oil is created equal. CBD oil is not regulated for purity and potency, and unfortunately there are hundreds of CBD oils on the market that are just pure garbage. I'm including a couple of these links to good quality CBD oils. I have no affiliation with either one of these companies. One of these oils contains no THC, but the other one does contain very low levels of THC, so you can kind of decide which one you prefer. Okay, on to treatment number 6, and that is hot and cold foot soaks. Now, some peripheral neuropathy sufferers will experience ice cold feet so cold they throb, while others may experience feet that feel like their feet are on fire, they're so hot. Now, foot soaks can give temporary relief. If you suffer from severely cold feet, soak your feet for 20 minutes in a foot bath with warm water and 1 cup of Epsom salt. This can help improve circulation, reduce inflammation, and soothe the nerves with the infusion of magnesium contained within the Epsom salts. Now, on the other hand, if your feet are on fire, cool them down with a cool water soak. You can use Epsom salt and essential oils like peppermint oil or chamomile in either the cold or the warm soak to help reduce the pain and the symptoms. Now, treatment number 7, essential oils. Now, essential oils have been used medicinally for over 1,000 years. There's plenty of documented research showing its efficacy in treating nerve pain. Now, the essential oils that have been proven to be most effective for nerve pain are helichrysum, wintergreen oil, peppermint oil, marjoram, and lavender essential oil. Be cautious when purchasing a pain cream because most of the products contain toxic ingredients. These are usually listed in the section on ingredients labeled called inactive ingredients. You want to stay clear of things like artificial coloring or dyes, parabens, propylene glycol, and many other chemicals. If the ingredient name is too complicated to read or understand, you should just stay clear of it. I'll leave a link in the description below to our own pain formula that we use with our neuropathy patients, which contain all the essential oils mentioned and is completely natural with no chemicals or toxins. And finally, treatment number 8, stretching and exercise. Stretches and exercises are so important for peripheral neuropathy sufferers. These practices will increase your endorphin release and decrease your pain. It will also increase circulation and helps to increase your pain tolerance. I'm going to leave you a link down below with one of the stretching and exercise videos that we developed specifically for our peripheral neuropathy patients. These are great for any level of neuropathy sufferers. For people who are in severe pain and are struggling with movement, we've even broken down the stretches and exercise up into individual videos that only span a couple of minutes. This will allow you to start with just one exercise until you can build up enough tolerance to do more. Well, that's it for now, Health Explorers. Which one of these techniques will you try? Leave me a comment, and if you've tried one of these techniques, tell me which one worked for you. Remember, our goal is to help you overcome peripheral neuropathy and reclaim your life back, and controlling your pain, and preferably without the harmful drugs. Don't get discouraged if you try one of these methods on the list and it doesn't work for you. Just move on to the next method. It's quite common for me to have one patient say the CBD oil worked like a charm, but not on the next person. So don't give up. Once again, thanks for watching and following us. Don't forget to subscribe to our channel, and remember, we release new videos every week, so make sure you click on the bell so you get notified. One last request. There are so many people out there who are struggling and feeling hopeless in this battle. We want them to know that they're not alone and that they don't have to settle for a life of misery. By simply liking our video, this will allow YouTube to share our video with others who are suffering from peripheral neuropathy. Well, until next time, my friends, I look forward to seeing you on the road to great nerve health. I've been effective that one's tripping me up a little bit. Oh, it just jumped. Right there. I misread it. So go ahead and bring it down so I can start and